Hello everyone, how are you doing? Welcome this evening, and I'm Vincent Obita, and today I'm going to take you through a care plan for a MUST patient. This is as requested by one of my viewers, and this usually station that in the previous in the old OSCE it takes 15 minutes, in the new OSCE it takes 14 minutes, but there is no major difference in terms of the content that we are supposed to provide. So for the MUST patient, that's for patients with the risk of malnutrition. So you are usually provided with a MUST chart, that is Malnutrition Universal Screening Tool, and it will be pre-filled, and you will have it at the planning stage. The only issue that you will be required to attend to is adding them at every step and giving a total score, then sign them with date and time as well as your signature. So after having any value that is above 0, that is 1 and above, that patient is at risk of malnutrition, and that itself is one of the care problems that you will take care of during your care planning. Okay, so for this patient, one care problem, that is the patient is at risk of malnutrition. Then the patient usually presents with other problems. It can be self-care deficit, it can be non-compliance to medication, which is usually common. They usually have non-compliance to medication, and they will have erratic HbA1c level, and that will be a very key element in terms of writing care plan for a MUST patient. Now, I'll give you just as an example of how you can write your care plan for a MUST patient. And for my patient, I'll give her a name, and that would be Mary Greenwood. So I'll state that my first problem is the risk of malnutrition. And remember, this is a risk. So risk you don't evidence because it's not yet confirmed. Now, if my score in the MUST chart was 2, then that's a patient who is at high risk of malnutrition according to this chart. Now, I'll come and state that Mary is at risk of malnutrition related to, okay, related to MUST score of 2, okay, or related to non-compliance of medication, or related to poor feeding, depending on the content you are having in your scenario. Ideally, the evidence would be around MUST score of 2, but you won't evidence the risk. But you will provide that the risk can be shown by the assessment you've provided. So you can state that Mary is at risk of malnutrition related to poor feeding and MUST score of 2. Okay, with that one you've provided a general view that the assessor won't penalize you. Then the next thing will be the aim of care, and you will state that Mary will have improved nutrition and a MUST score of less than what is provided. If the MUST score was 2, then you will say less than 2 following nursing intervention. Don't usually be very specific because you can't have a specific like a very, very specific figure for what you want to attain, but you can say less than 3 to mean you less than 3, less than 2, less than 1 to mean you are aiming for the best. So I'll state that Mary will have improved nutrition and a MUST score of less than 2 following nursing intervention. Now, and to reevaluation date, I'll state that to be evaluated every 1 week or more frequently when the condition changes. Remember, most patients are at home, so you are usually doing, or the diabetic nurse or the community health nurse will just give them a 1-day visit. So you will just stay to be evaluated every 1 week or more frequently when condition changes. For the care provided by nurses, that you will follow the EMATARID. Remember, you do five general points, then 3 specific. So for the general, you explain and discuss the aspect of Mary's care and gain consent. For the part of monitoring, I'll state that monitor and record Mary's vital signs and MUST score every 1 week and escalate to the general practitioner as needed. Remember, this is a referral to the community. That's why you are escalating to the GP and not any other person. Then administer prescribed medications and supplements and check their effectiveness. Remember, for most, the supplements can get in. Okay. Then we have now the specific points in relation to the risk of malnutrition. Consider teaching Mary on how to take her weight twice a week, to provide a diary for nutritional monitoring. That's one intervention. 2, encourage Mary to maybe have a balanced diet. Okay, if from the scenario the patient was not having a balanced diet, so encourage Mary to have a balanced diet to ensure improved health. Remember, you connect the reason, the content and the reason. Then the third, which is usually refer Mary to dietitian for further assessment. Then instruct Mary on calling GP when in need of any assistance. Unlike the other care plans where we usually say instruct on proper use of call bell, remember the patient is at home, so getting help is through GP. So instruct Mary on calling the GP when in need of any assistance. Then you finalize by stating document all cares as planned. For the old OSCE, you would state the self-care activities, demonstrate proper way of taking weight and recording them. Mary verbalizes understanding of our care plan. Mary verbalizes understanding of health education given, and Mary actively takes part in her care planning. With that one, you are done with problem. You are done with care problem 1. Then you will now shift to the patient care problem 2, and this usually maybe what you had identified during your assessment or is in the patient's social history. So for this case, I gave Mary a problem of being non-compliant to medication. Okay, and this can be related to the HbA1c that was recorded or was provided in the previous assessment. So I'll state that Mary is non-compliant to her medication due to self-care deficit, as evidenced by HbA1c percentage, you put it there, and MUST score of 2. Remember, for the MUST patient, you have to place the MUST score in both care plans, irrespective of the care problem you are talking about. So you have to evidence it with the MUST score. Then the aim of care will be Mary will be compliant to her medication and have a MUST score of less than 2 and an improved HbA1c, depending on what was provided. Then for reevaluation date, to be evaluated every 1 week or more frequently if the condition changes. After that, you move to the care provided by nurses, and here you do the 5 basic points, that is, explain and discuss all aspects of Mary's care and gain consent. The aspect of monitoring still remains the same. Monitor and record Mary's vital signs and must score weekly and escalate to the general practitioner as needed. Third, administer prescribed medications and supplements and check their effectiveness. After that, you go to 3 specific points that relate to non-compliance to medication. You can encourage Mary to put her medications in strategic points such as next to television for easy remembrance. You see my point and the rationale I'm giving unto them. You can refer Mary to pharmacist, okay, to provide them with the blister packs that will ensure they have improved compliance. The blister packs will just is just a pack that will have their medication combined, the ones that they receive at a specific point. Then at that point, you can also teach Mary on the use of sticker notes or reminders. Sticker notes which will enable them improve their compliance. You can teach them on the use of alarms to allow remembrance. With that one, you will have your 3 specific points to non-compliance. Then you will have instruct Mary on reaching out to general practitioner when in need of any help. Then document all cares as planned. For the new OSCE, with that one, you are done. You just sign with your name, signature, and date, and your care plan is done. For the old OSCE, you will go to the self-care activities, right? Mary verbalizes understanding of the healthcare education given. Mary verbalizes understanding of her care plan. Mary actively takes part in her care plan, and Mary demonstrates proper use of alarms and sticker notes in developing a plan for their compliance to medication. After that, you sign with your signature, full names printed, and the date provided. That in place, you are done with care plan for most patients. Remember, you can also consider other care problems such as self-care deficit. Yeah, it depends with how you examined your patient prior to the examination. Other elements or other care problems can develop, and that will be upon you, but usually take whichever thing that you can have all your points noted down nicely. So for the MOOS patient, the takeaway home is the MOOS score have to appear in both care plans. That's the takeaway home point. Okay, with that one, I'm happy you are able to tackle the most patient care plan, and all other care problems will just take that direction. Thank you so much, and you guys have a good night. For those who are taking their OSCE this week, and also those who are doing their OSCE next week, I wish you all the best. You are really going to pass. Be confident, and you will smash it early enough. Thank you, and bye for now. See you then.